Celeste, our policy director, and Ghazi, our administrator, and our postdoctoral scholar, Amy Fisher. We are delighted to welcome you to the annual Kessler Freedheim lecture. Thank you all so much for joining us. I know this is a busy time of year for many of you. Certainly for us on campus, it's the last week of classes, so we are busy. If you haven't already done so, please go ahead and feel free to have some food and find your seats, as we want to get as much time in for our lecture and discussion as possible. We've also created a policy brief document for you all today. If you didn't get one on your way in, please go ahead and pick one up on your way out at the check-in table. We have an exciting and extremely important topic today: integrating early care, education, and poverty reduction to support child development at scale. Today's talk reflects the Schubert Center's mission of linking research, practice, education, and policy to enhance the well-being of children and families, and our commitment to promoting equity for all of our children. We're thrilled to have our speaker here today, Dr. Hirokazu Yoshikawa from NYU, as well as discussants Dr. Shauna Lorman, the interim director of Cuyahoga County Invest in Children, and Angela Newman-Wright, who is the director of First Year Cleveland here at Case Western Reserve University. Unfortunately, Gloria Blevins, who was on our program, is unable to join us this morning. We're also thankful to have the support of both the College of Arts and Science and the Jack Joseph and Morton Mandel School of Applied Social Sciences. Deans Ward and Voisin are going to offer a few remarks before we get started. We want to make sure all of our remarks are brief so that we can get to the main event. Please help me welcome Dean Joy Ward.
Good morning, everyone, and thank you so much for being here at this very important event. I am delighted to welcome you to Case Western Reserve University and the Schubert Center for Child Studies annual Kessler Freedheim Lecture.
The Kessler Freedheim Lecture, now in its sixth year, is dedicated to two very important leaders. The first is Dr. Jane Kessler, Emeritus Professor of Psychology and the director of the Mental Development Center, which led to the Schubert Center today. The second is Dr. Donald Freedheim, Emeritus Professor of Psychology and the founding director of the Schubert Center. I would like to express my heartfelt gratitude to Dr. Kessler and Dr. Freedheim for their invaluable contribution to this event. Their dedication to child welfare and well-being has been vital to the Schubert Center's essential work. This annual lecture allows us to honor the distinguished history of child-centered research at Case Western Reserve University. I want to extend our appreciation to the George Gunn Foundation, whose generous support has made this event possible. I also want to extend our appreciation to our campus and community partners, including Groundwork Ohio, Invest in Children, Black Child Development Initiative in Ohio, Ohio Association for the Education of Young Children, United Way of Greater Cleveland,
Cuyahoga Community College, Bright Beginnings, Birthing Beautiful Communities, Pre-for-Cle, Starting Point, the Mary Ann Swetland Center for Environmental Health, First Year Cleveland, and the Social Justice Institute. Again, we are thrilled to have you all here today and look forward to an engaging and important discussion about a more coordinated approach to reduce the impact of child poverty in our nation. Thank you, and now I'd like to turn it over to Dean Voisin. Thank you.
Good morning. Anytime you have a welcome to a welcome to a welcome, you know you're in for an academic treat with our speaker today. So I'm delighted to welcome you again here today as we discuss the critical issue of child poverty. Now, as many of you know, the Schubert Center has had a long history of focusing on issues that impact our children and the community in which they live. Issues such as education, employment, crime, health, and policing. And we know that many of these factors are highly correlated, and they're more importantly highly correlated with poverty, which has become racialized in America. A major aim of the Schubert Center is to thread the needle when possible to bridge research, practice, policy, and education. The center is very much proud of its community-based, community collaborative work. Through collaborations with research associates from various schools, and I see many of them in the audience here today, and community organizations, they bring into sharp focus research in child well-being, education, family, economics, health disparities, and social justice. Now, the center is involved in many community collaborative projects, and I'll just highlight just a few. The center is currently evaluating the effectiveness of Open Doors Academy, an after-school youth development program, and they're also providing important consultative services for Scholar House and Family Space. Once again, I'd like to welcome you to the Kessler Freedheim Lecture and at Mandel School of Applied Social Sciences. We look forward to continuing to support this important work. Thank you.
Good morning and welcome. I'm Sonia Minnis, the Schubert Center for Child Studies Research Director. I'm here to introduce Dr. Yoshikawa's important work. Dr. Yoshikawa's lecture will focus on his recent research and policy implications that focus on economically disadvantaged children from birth through kindergarten. He draws on many years of early childhood education and research, and his current work is focuses on the effects of unconditional cash transfer for families struggling economically. He and his colleagues in their work in the book publication Cradle to Kindergarten offer a coordinated policy of reforms that are focused on affordable quality childcare, universal quality preschool, and paid parental leave, Head Start reconfiguration, and childhood poverty reduction. Dr. Yoshikawa is a Courtney Sales Ross Professor of Globalization and Education at NYU Steinhardt, a university professor and co-director of the Global Ties for Children Center at NYU. In addition, he's a core faculty member of the Psychology of Social Intervention and Human Development Research and Policy programs at Steinhardt and faculty affiliate at the Institute of Human Development and Social Change and Metropolitan Center for Equity and the Transformation of Schools in New York at NYU. Dr. Yoshikawa earned his PhD in clinical psychology and two of his masters from the degrees from NYU. He studies the effects of public policies and programs related to immigration, early childhood education, and poverty reduction on child development. His current projects are many, and they include evaluation for the MacArthur Foundation, 100 and Change, and Lego Foundation, funded partnerships of Sesame Workshop with the International Rescue Committee, and BRAC to provide early childhood programming for refugees. He also is a co-investigator of the first experimental evaluation of unconditional cash transfer for families with young children in the United States, which we'll hear more about today, and the Listening Project, a project to empower youth and adults to engage in in-depth questioning and listening. Dr. Yoshikawa's awards and honors are many. Collectively, they reflect his outstanding work in the field of child development. Just this year, Dr. Yoshikawa was awarded for his distinguished contributions to public policy and practice in child development by the Society for Research in Child Development. By presidential appointment, he became the National Board of Education Science member at the U.S. Department of Education. Dr. Yoshikawa is an elected fellow of the National Academy of Education, the American Academy of Political and Social Sciences, and the American Academy of Arts and Sciences. He's a trustee of the William T. Grant Foundation and has received awards for his mentoring of ethnic minority students. He's authored 8 books, 58 book chapters, over 200 scholarly publications, and well over 100 practice and policy implications that apply to both U.S. and international policy. Welcome, Dr. Yoshikawa.
Thanks so much for the embarrassing introduction. I do want to thank folks at the Schubert Center for this really wonderful invitation, Anastasia, Sonia, Gabrielle, Anne. It's been a great visit to get to know the work here, and also got to visit the William Patrick Day Head Start and UPK Center today, and spoke to heard about the incredible programming going there under the leadership of Dr. Chisholm and Dr. Wilson. I think Dr. Wilson is here. And their exciting new collaboration with Scholar House, which is an area around 2-generation programming that's actually very close to my heart from a project in Tulsa. So yeah, very happy to be here. I'm going to talk about this, what it would take to bring the United States, as well as every city and county and state in the United States, to the forefront of global investments in early childhood, which require, I think, a truly integrated early childhood policy, which currently the United States lacks, despite being the richest country in the world. So the challenges of braiding access, quality, finance, and implementation to address inequities that affect our youngest children at the point in time when they are the most sensitive to environmental influence is really what drives this work. And I'm going to argue that the elements that we need are a quality early childcare system rather than the fragmented picture that the prenatal to age 3 period represents for far too many families. Quality in universal early education, intensive family support for those who need it from the prenatal to school entry years, and direct poverty reduction. There are few integrated national policy proposals with cost estimates and the science base explicit, and so I'll present a book where we aimed to do that. And I'll talk a little bit later about how this kind of approach has been applied in the United States, but in several states across the United States since 2017, when we published the first edition of this book. I'm not going to lie, it was meant for the Hillary Clinton administration. We switched our dissemination strategy to states at that point, and to the country of El Salvador, and then brought out an updated set of proposals and cost estimates for the Biden administration, and that's the second edition of the book in 2021. So starting with that, of course, we know that far too many kids in the U.S. are not entering school ready to learn, and that the COVID pandemic created an extraordinary stress on families and left child learning essentially in the hands of families and communities for months. And we have all not recovered. So the William Patrick Day Center and its grantee went from having something like 2,800 children to now 1,700 children. So 1,000 kids lower than pre-COVID, and this is something that we see across the country. Disparities by family income, race, and ethnicity are largely present at school entry. They are largely about the same size as they are in high school in areas like achievement, learning. So that shows us that there's a lot that we could do in the early childhood space. And I'm going to argue that access and quality are not two separate things, that access and quality need to be invested in together. And particularly during these earliest years when it is perhaps one of the most important periods of child development. I'm also a youth development expert, so I'm not going to say instead of investments in youth development, but certainly the early childhood period is distinguished by the least investment, public investment in terms of age range. So these are some of the disparities that we see across quintiles, SES quintiles, and race in the United States. I'm not going to go in detail over these. I think these are far too familiar for us, but the gaps have been growing. And just as an indicator, this is how much the gaps have grown. Not just, in fact, the gap between the 10th income percentile and the 50th has not grown nearly as much as the gap between the 50th and the 90th, which means that there have been far more opportunities garnered by those in the high end of the income distribution that have benefited their children and youth and have made the overall disparity wider. But this is based on a combination of 6 or 7 different data sets by Sean Reardon at Stanford University. And in comparative perspective, our gaps are simply larger. These are the bottom blue, the darker blue is the medium to low income gap, the 10th to the 50th percentile size, and the medium to the high is the 50th to the 90th percentile size. And you see that the US gaps in math and reading are much larger than the ones in the UK, in Australia, or in Canada. This is just, you don't even need to look at the dollar amounts. These are the relative amounts that the United States spends per child. In the K to 12 years are the bigger yellow bar on the right, and the before kindergarten, the early childhood years, in the little blue bar, which is how much is being spent on children before school entry in the United States. So you see this massive gap in spending overall. So I'm going to present the key elements of our updated plan for high-quality early childhood policy that we think would bring the United States from the bottom of the rich countries. The United States is currently around the bottom of the OECD countries in spending in early childhood per child. And if these were implemented together, we would shoot to near the top of the OECD. And in fact, if Build Back Better had been passed, which it nearly did get passed until that particular Sunday, I guess that was in December, a little while ago, it would have launched the United States into the upper range of investments in early childhood among the OECD countries. And these are the elements: paid parental leave, a guarantee of child care assistance to going way up to the state median income of 150% of the state median income, universal early education for 3 and 4-year-olds, and reimagining Head Start to begin early and really fully fund early Head Start and have it be a prenatal to age 5 program. So the majority of Americans, of course, still don't have access to paid parental leave. I understand this is under a lot of discussion here in Cleveland, and there are places that are investing in municipal parental leave, but we really do need universal access. And we have continuing accumulating evidence of the benefits of paid parental leave when it is offered, and it is offered in an increasing number of states, but not here. So we see that 1 in 6 workers currently have access to paid leave in the United States. And it may be that COVID pandemic relief efforts potentially set the stage and certainly showed what the government could invest in families. But we see far too low access, particularly for those in the bottom quarter of earnings. And I don't need to go into the details of why the FMLA excludes the lowest income workers and those with the most unstable or shortest jobs. Precisely the ones we want to support the most are not supported in the Family and Medical Leave Act as it stands from the federal government. So we propose paid parental leave guarantees families at least 18 to 24 weeks per family of paid job protected leave, with a percentage of their wages on the leave progressively structured so that those with the lowest base earnings get the most in terms of the proportion of their earnings. Administer this as social insurance through the Social Security system, because we believe that being born and having a child are common life experiences like old age or disability for which we can and should ensure economic security, and so that it can be built into the Social Security system. Turning to childcare, there are large disparities by family income in use of the early learning programs, and what's extraordinary here is how early these disparities start. So if you look at the left set of 3 bars, that's the under 12 months age. And so those with middle and higher incomes above 400% of the federal poverty line, 17% are utilizing out-of-home center-based care, and for the under ones, it's 7% and 6% for the lower income. The second set of bars is for age 1. We continue to see that disparity at age 2, at age 3, at age 4. These are large disparities in access to center-based care, which we know is the kind of care that provides the most stimulation and learning opportunities. Despite the kind of problems that we have with quality, center-based care is an opportunity for learning, particularly if we support it with the proper professional development supports. But it's not just an access problem, it's a quality problem. So in this book, we ran numbers that had never been run before on a national level, which is the numbers showing that the lowest income quintile experiences substantially lower quality of care. By the FIDCRs, which is the family daycare version of the ECHRs, on the left, for non-relative homes, similarly using that measure, and on the right, using the ECHRs, which is for center-based care. So in all of these, the poorest families experience the worst quality care. So this is both an access and a quality problem. So families with incomes below 200% of the federal poverty line currently spend a whopping 22% of their incomes on childcare. Only 15% of families are receiving eligible families are getting childcare subsidies through federal and state CCDF funding. And of course, these rules are very complex and are hard for families to navigate. Child care tax credits are very minimal and are not refundable, which means that those who are not making enough earnings to pay taxes are not getting them, which means that they exclude the poorest families. So our proposal is a child care guarantee to all eligible working families, with families eligible up to 150% of their state's median income, because we believe this is really a problem that goes way up into the middle class in terms of affordable child care. The subsidies are adequate to pay for quality. We also argue for an increased refundable child care tax credit. I should mention the child care tax credit is a separate federal policy than the child tax credit. So this is specifically for child care. And that the tax credit provide and support paid costs for all types of paid care, with the maximum benefit increased to $4,000 for one child with the child care tax credit. For universal preschool, in most rich countries, nearly all children receive a public education starting at age 3, but you see that the United States is on the lower end of this OECD table of enrollment rates of 3- and 4-year-olds in pre-primary education. So early education, of course, we know benefits all children's early learning, with larger benefits to more disadvantaged children. I think you all know the evidence on the long-term effects of model preschool programs. There is new evidence that the Tulsa Universal Pre-K program produced benefits way up into college in terms of college enrollment. So this not only goes for those small model programs that started in the 60s and 70s, but also to a program at scale, Tulsa being one of the cities as part of Oklahoma's Universal Pre-K program that was has a very interesting history, by the way, of how it got started. That's on NPR, and it was on This American Life show about how to sneak things in to. Anyhow, it was snuck into state legislature policy with some concerns that around the hours of kindergarten. To sustain the early education boost, we have increasing evidence of this thing called fade out, which is not really the right word, but it's catch up, right, of kids who have not experienced preschool catching up with their peers. We think that there's a few different ways to address that. One of this is integrated pre-K to third grade alignment in curricula and quality. And the second is to focus in preschool on broader skills beyond decoding, basic numeracy, so to get to things like oral comprehension and vocabulary. That if we focus on the constrained skills, which are simply the identifying letters, or counting. And of course, we know that a good preschool program goes far beyond that in terms of social emotional skills, well-being, and these broader skills, right? Beyond simply identifying letters. We are more likely, new evidence shows that those benefits are sustained for longer into the primary grades. At the same time, we know that there are effects that go into high school with a high-quality preschool program that have to do with kids' motivation for schooling and their engagement with school. So these are some of the issues that we're grappling with, particularly as we go to scale with preschool programs for all. Public preschool expansions have been very slow and huge enrollment declines post-COVID, over 10% in nearly all states in the latest NEAR yearbook. Very slow increases prior to that. So we're still really far behind our goals as a country, and in fact the global goals. Early childhood development was part of the development of the Sustainable Development Goals and the UN process prior to 2015, and when we got in early childhood development, it became a global consensus to provide universal preschool to all young children before primary school, all children in the world, and yet we're the richest country and we're still quite far from that. Of course, we've had for decades these innovative ways to braid Head Start with preschool funding, as I saw this morning here in Cleveland, but that's still not enough. And we see far too much variation across states, across cities, across counties. I am learning that the city and the county levels are really important to distinguish here in this part of Ohio. And our proposal is very much along the lines of what President Obama initially proposed but was not able to achieve, what President Biden built into Build Back Better, which was universal high-quality preschool for all children ages 3 and 4. I live in a city that was able to implement that under Mayor de Blasio, though even in New York, the New York Times recently reported that enrollment rates have slipped, and so the outreach is not adequate to fill some of the slots in New York's UPK system. A key here is the pay parity with K-12 teachers. That is a kind of economic injustice that draws teachers from preschool into other systems far too quickly and creates far too much economic precarity for the largely black and brown teachers who represent a huge proportion of our early childhood workforce. And so with benefits, so that they're not hourly workers, this being an extraordinarily important distinction here, I think, in Cleveland, and not to sacrifice quality. And so we built into our proposal, and it was built into Build Back Better, not just consistent structural quality standards, but developmentally focused play-based curricula and professional development, including in-person coaching, a full school day, wraparound care options that are supported by the child care assurance, which is how those two parts of our proposed policy would work together, and sequenced for 3 and 4-year-olds, and then also to prohibit the kinds of expulsions and the disproportionality that results in discipline, in the control in classrooms of black and brown bodies and their agency to learn, which is ultimately what's reflected in rates of expulsion and suspension from preschool in the United States. Finally, we think that Head Start, with expansions in universal pre-K funding in preschool, ultimately in the long run, we think Head Start can be re-envisioned and really even further expand its approach as a comprehensive family support program, not just an early learning program. And of course, with COVID-19, we know that the demands of well-being, of learning, and all these fell on families and communities. And yet Head Start funding for the kinds of comprehensive family support, mental health screening, professional development, and inclusion services for which it's been known for decades and which have been baked into the Head Start performance standards, funding per child for those services has declined over decades. And I've been working with Head Start since the early 90s when we did a Head Start mental health report. And back then there was at least a fairly robust and much greater funding for training and technical assistance, for the kinds of mental health consultants and social services and health services that are a key part of Head Start, and those have declined as per child spending over decades. We also believe that prenatal to school entry services are needed for those living in concentrated neighborhood disadvantage and facing higher adversity. And so a new birth to school entry Head Start would target the most vulnerable children, with services starting before or after birth and increase for that most vulnerable group up to 40% eligible. This would integrate early health, home visiting, and center-based early learning with family-focused mental health and social services, raise that per-child funding up to the level that it really should be, employ Head Start as a community service hub, generate and evaluate innovations in culturally responsive birth to school age services. There's a lot of work going on in the preschool space around things like culturally responsive pedagogy, but there needs to be more in the 0 to 3 area. And maintain current coverage of 3 and 4-year-olds. We're not talking about decreasing or kind of shifting funds within Head Start, but simply to increase the 0 to 3 funding and target it and expand it. And of course, to continue to braid Head Start with pre-K funds as it's being done here, as it's being done in West Virginia and DC, to make it, to increase socioeconomic integration and racial integration in Head Start programs. So we developed cost estimates recognizing that the U.S. lags nearly all nations with advanced economies in spending on early childhood care and education as a percentage of GDP. So again, we're used to seeing these where the U.S. is on the left, but this is spending in the early years as a percentage of GDP. So this is where we went beyond the typical book and actually ran all the numbers for this. And so this made our book a somewhat more policy-ready proposal. So there's a lot of wonky decisions that went into the childcare policy, each of these components. But the new investments, which we thought at that point were really quite ambitious, are actually a fraction of what was possible during COVID in terms of the American Rescue Plan, as well as the expansion of the child tax credit, which reduced child poverty by 40%. So we did inform the development of the Child Care for All Working Families Act by Senator Patty Murray and Representative Bobby Scott, and the Build Back Better proposal. And then we worked intensively with several states, basically choosing states that had certain pillars of the Cradle to Kindergarten proposals in place and were looking to expand or coordinate. So with limited dissemination funds, we went to a few states: Washington, Oregon, Colorado, California, West Virginia, Washington, D.C. And for each of them, we developed state and locally specific budget estimates of this kind of coordinated set of proposals. Given that I work these days largely in low and middle income countries, worked with UNICEF El Salvador to bring the framework to a high-level coalition of child leaders there, and worked with an incredible leader at UNICEF who was really politically engaged and brought this in front of all 4 presidential candidates candidates, including the current president of El Salvador. All four committed. It was the first time they met at one single public meeting, and they all four committed to, should they be elected, investing in a comprehensive ECD policy. And this went into informing the current national ECD policy in the country of El Salvador. Okay, turning to the last poverty pillar, which is direct poverty reduction. I'm going to talk about a study called Baby's First Years, which addresses this big gap in the research literature. We've had many, many hundreds of evaluations of preschool programs, of early parenting programs. We have never had a large-scale impact evaluation of the effect of direct poverty reduction in early childhood. And so this is a project that took 7 years of weekly calls to raise the funds for. We have about 25 different funders, and it is to really produce this kind of causal evidence to understand the effects in the very first years of life, starting at birth. So our questions are whether a monthly unconditional cash gift supports young children's healthy development and brain functioning, and whether it improves family functioning and better enables parents to care for their children. We believe that cash transfers may improve children's development through increased parental investment in kids in terms of their expenditures on children and perhaps reduce parental stress, but we acknowledge that cash itself cannot address the larger stresses of systemic racism and discrimination that affect low-income families and families of color and Black and Latina families and Asian American and immigrant families as well. So that's a caution here, is that, in fact, our data show some of this. So I'll show you some of this data that's relevant to this issue of stress. This is what the gift looks, the card comes on. It comes on a debit card, and the only other intervention is that it says "For My Baby" on it. And it comes on the day of the anniversary of every month of your child's birth, because all the moms were recruited at the hospital on the maternity wards. And it does not require prior banking, and so if a family was unbanked, we worked with them to understand how to use a debit card, and they did not have to have a social security number either. So we recruited 1,000 low-income mothers in 4 metro areas: New Orleans, Omaha, the Twin Cities, and New York City. And the High Cash Gift Group gets $333 a month, about $4,000 a year more than the control group that gets $20 a month. We have qualitative work going on in Louisiana and Minnesota. And this was originally a 3-year plan. We've since raised the money, so it's a full 6 years that they'll be getting, and our kids are turning 4 right now. So COVID occurred of course, at a point when we were collecting data in homes, so we switched over to phone-based data collection. Of course, our age 4 is now back in person. We have a diverse sample of low-income families and infants, including first-generation immigrant moms, primarily Black and Latina women. Among the Latinas, Dominican, Mexican, and Honduran are the biggest groups. Average household income is about $22,000 at birth, and so this cash gift represents an addition of roughly 20% to household income. We've been able to retain over 90% of our sample up to age 3, so we're very, very proud of that fact. Here's some of the findings that came out about a year and a half ago that produced some press. So our first indicator of child development was at 12 months. EEG measures is kind of done with a cap on the baby's head of brain activity. And what we hypothesized was that children in the high cash group would show higher, more fast-paced brain activity in the faster ranges. We all have faster and slower brain waves going on, all of us, and so we expected that difference would be in the right-hand side of these figures, in the kind of pattern that we see on the left, with the high cash gift group perhaps having higher levels of faster-paced brain activity, and that's exactly what we saw at age 12 months with the partial sample before COVID shut us down. So what are our pathways? That's a lot of technical stuff I'm not going to skip over. How we did our analyses. We did our analyses right. correctly, I believe. So first, what was the increased investment pathway? Were they actually spending the money on children's learning materials, for example? Were they spending more time with children or interacting with children? And so the first question we would ask is, did the unconditional cash gift reduce poverty? Yes, it reduced poverty. Even so, the caution is that the majority of BFY families are residing at below 200% of the federal poverty level. A caution, one difference between this and the expanded child tax credit: the expanded child tax credit for 6 months provided $300 a month for every child you had in the family under 18. We only provided this for one child, right? And so 60% of our families actually had older kids, but this was for one child. If anyone knew that that was about to happen before we started our study, we would have maybe upped our cash gift amount, but we thought that was the most maximum feasible. We thought people would just like roll their eyes at anything larger in terms of it not being policy relevant. So we don't see much of an effect at all on labor force participation. Economists actually care a lot about this. I would say as a developmental psychologist, I cared less, but we don't actually see much of an effect one way or the other on moms' employment. By age 3, 14% of the moms report additional educational courses and certificates. So from this two-generation perspective, it's very interesting that this cash gift is enabling more attendance in classes among the moms at age 3. No impacts on sleep quantity or quality, but a robust effect on spending more time on reading, storytelling, playing, and related activities. About 10% more time a week on those kinds of stimulating activities. In terms of expenditures, they are spending more on child goods, and specifically things like books and toys and clothing. A little bit more on out-of-pocket childcare, but we see no effects so far on type of care yet, on things like center-based care or those kinds of things. We see zero effects on these called alcohol, cigarettes, or substance use. So no effects from either our transaction data from the debit cards. We actually have coded every single establishment that they use the debit card at, and there's no evidence that they're spending more at liquor stores, for example. This gives you a sense of the increased spending on books, toys, and activities, and the increased time spent on reading, storytelling, and playing. From our qualitative study, we don't find a single story of what the mom spent the money on. They all find it extraordinarily meaningful, and they say that it is for my baby, this is for my children. So they're really absorbing the fact that this started at their child's birth. Financial strain is something that is at the top of their minds, and even more so now with inflation. But this seems to enable new possibilities. For example, we're finding at age 3 that they're going into more debt on cars, which is really interesting, that they're using some of this for long-term investments, like fixing that car or buying a new car. And so those are important long-term investments. And this is viewed as independent from government assistance. This to them has no association with welfare, for example. Finally, reduced stress. Do we see evidence of reduced stress in terms of economic pressure, psychological distress, relationship quality? And so these are some of the, I'll skip because I'm running a little short on time. Basically, we see very few effects on stress, and this is where I think there needs to be pairing of poverty reduction with other kinds of interventions that may reduce stress, including well-being and mental health supports. We see no impacts on food insecurity, on economic hardship, or financial worry. No impacts on perceived stress, if anything, an increase in parenting stress. No effects on depression, a bit of an increase in anxiety that came from the 12-month point, but not later. And no impacts on physiological stress, which was from hair cortisol. We see that robust effect on parent-child activities, so an improvement in parents interacting with their children and providing kind of learning activities like reading and singing songs. No effects on the video recorded coding of parenting, though, and a slight trend towards reduction in spanking, but not significant. So we see evidence of persistent increased expenditures on child-specific goods, more time spent on children's early learning that may be linked to that early impact on brain activity, but no evidence that there are improvements in family stress. And again, I think that calls for the kinds of additional service interventions that I know many of you are working on, and those need to be paired with financial supports. The findings are substantively similar for Black and for Latinx families and across cities, despite the fact that those cities have different costs of living and different policy environments for young kids. So this study was it was very focused on a single cash transfer, not to eliminate poverty, but to reduce poverty. And it certainly doesn't tell us the best way to redesign our economy to address other issues of systemic discrimination or racism. And it was, of course, not designed to address COVID. And so all families in our sample went through both the stresses of COVID and some of the supports that the government provided. Our families reported about 70% of them reported receiving stimulus payments and or the expanded child tax credit. But this does provide an important test of whether reliable and regular monthly cash support can support children and moms. And we are continuing with our age 4 data collection. In about 8 months, we'll have data on actual in-person collection, a lot of in-person data collection around kids. So to conclude, hope I've given you a sense of what the U.S. system and what a local system might be able to provide, which is coordinated investments across parental leave, early family support, and early learning programs, as well as poverty reduction. So the principles here are that developmental and poverty reduction supports really need to consider early childhood a really important period, build on the evidence of what works and supporting quality, invest in providing both access and quality increases and not consider that a trade-off, be responsive to family needs, including trauma-informed care principles for both workforce and families, and culturally responsive pedagogy. And as just kind of a lesson for proposals, it's helpful to provide cost estimates. They're more likely to be received by the policy wonky world as stuff that's more readily and immediately useful and translatable into legislation. That's a lesson that I bring. I didn't have that experience. It's really AJ Chaudhry and Tara Morrissey who had experience in both city and federal government that brought that experience. So thank you very much to collaborators in Cradle to Kindergarten and to the Baby's First Years team and the huge number of funders for that unconditional cash transfer project. Thanks so much. Look forward to the discussant comments.
Thank you so much, Dr. Yoshikawa, for those for sharing your research and those remarks. And we're going to open up to you all for questions after we have an opportunity with our discussants, who thankfully will now get some water. So thank you, Anastasia, for that. I'm Gabriella Celeste. I'm the policy director here at the Schubert Center for Child Studies, and I'm really delighted to be here today to introduce our discussants. I did want to acknowledge, I see a few of our friends, special friends in the room, especially Chief Pryor Jones with Mayor Bibb's office. We're glad to have her here, and I know the county exec's office is here as well, and other friends. So really appreciate you all being here. I want to introduce, the way this will work is I'll introduce both our discussants. We'll have them come up one by one, and then we'll open it up for our audience kind of Q&A. So first we have Shauna Warman. Dr. Warman is the interim director of the Cuyahoga County Office of Early Childhood Invest in Children, which oversees an early childhood service continuum from prenatal to kindergarten here in our county. She's a sociologist by training and brings this lens to her work to better understand how our social systems shape children's early experiences and environments, and how we can improve those systems to ensure all children have opportunities to thrive. Shauna came to Invest in Children in 2017. She was the evaluation manager and most recently the associate director. She graduated summa cum laude with a BA in Sociology and Criminal Justice from Baldwin Wallace University and received her master's in Sociology from the University of Akron and has a PhD in Sociology from Indiana University. We like to acknowledge all of our letters here at the university. I also want to introduce Angela Newman-White, who, by the way, I feel like deserves a special acknowledgement for stepping in literally this morning at the last minute when Gloria unfortunately had some travel plans. So what you read in the paper about airplanes and all that is true. Don't be careful traveling. But Angela, we are delighted that you're going to be with us here. Angela is the newly appointed, maybe not so new anymore, we'll give you that honeymoon, executive director at First Year Cleveland. She's been there since January of this year. First Year Cleveland is a public-private partnership formed to mobilize communities to identify and implement strategies to address racial inequalities in infant mortality. She has over 18 years of public health experience focused on addressing inequities in maternal and child health. Her most recent role before this was as grant supervisor at the Cuyahoga County Board of Health, and prior to that, she spent 6 years with the city at Moms First and the local Healthy Start project with the City Department of Health. She is passionate about grassroots efforts that address policy and system-level changes to support equity and overall health, focusing heavily on anti-racist work. She's been working in the greater Cleveland community to provide perspective, transformation, and shifting the narrative from individual responsibility to our shared system-level accountability and commitment to change. So in addition to participating in a number of state and local collaboratives, she was elected to the City Match Board of Directors and appointed to the Cuyahoga County Department of Children and Family Services Advisory Board. She holds a bachelor's in arts and sociology from Bowling Green and a master's in arts and sociology from Cleveland State University. Please join me in welcoming both of our discussants. We'll start with Dr. Rohrman.
Fair to say sociology is well represented here today. Like to see that. So thanks, Gabriella. Thanks to the Schubert Center for bringing us all together. And thank you to Dr. Yoshikawa for sharing all of your work with us today. My brain is going in a million directions. So there's so much to dig into. I'll keep my remarks limited and just share a couple of thoughts. So listening to your presentation today has me feeling really energized, a little bit sad, but mostly energized. And part of that is because I'm seeing things that you're presenting that we are doing locally. We are fortunate in Cuyahoga County that we have a pretty strong community awareness of the importance of early investments. We've got strong cross-sector partnerships that have led us to be a leader in the state when it comes to early childhood. So we've got a lot to be proud of here. A couple examples. So we see investments in the childcare system reflected in the percentage of childcare sites that are rated high quality in our Step Up to Quality system. We have a greater number and percentage of sites that are rated high quality in Cuyahoga County relative to both Franklin and Hamilton, the two other largest counties. Particularly noteworthy, I think, is the percentage of family childcare providers that are rated high quality, which is more than double the rate in the other two largest counties. That we can attribute in large part to our family childcare professional development network and the support that they receive to gain, maintain, and improve their rating in the system. So this piece was in the book and not something you specifically highlighted, but it's something we should be really proud of in this community because, as I understand, it's pretty unique in the state of Ohio and nationally. So thank you to Starting Point and our partners who do that work. In addition, our early childhood partners came together nearly 2 decades ago to envision a gold standard of preschool and created Cuyahoga County's Universal Pre-Kindergarten, or UPK, program. UPK is not technically universal, though it aspires to be universal. But many of the features of UPK are on the list of what you are proposing for universal preschool. So we've got a mixed delivery system of high quality providers that includes private childcare centers, Head Start, public school district preschools, family childcare, which enables families to choose the site that works best for them and receive the benefits of universal pre-K. We require a research-based curriculum. Staff receive coaching and technical assistance on classroom quality, social emotional development, assessments, family engagement, other areas. We provide quality enhancement funding, which sites have used in a range of ways, from outdoor classrooms to increasing the pay of their teachers. We combat expulsion by offering intensive supports to help sites develop inclusive practices. And we aim to make childcare more accessible and affordable, combining quality with accessibility through scholarships for families up to 400% of the federal poverty level. There's so much more that I could talk about that we're doing in our community, and we have so much to be proud of. At the same time, as we've seen today, we need investments at the state and federal level to make that system stronger. So when it comes to childcare, we're facing some mutually reinforcing challenges. One is the affordability of childcare, and the other is the ability to offer pay that retains and attracts great teachers. So I'm going to start with affordability. I spent some time thinking about how the child care assurance would play out here in Ohio as an alternative to our current subsidy system. So right now, initial eligibility for child care assistance or subsidy is 142% of federal poverty level, and a family can continue receiving a subsidy with increasing income up to 300%. So let's say you have a family of 4, their family income is 140% of the poverty level, they start receiving a child care subsidy, their weekly copay is about $65 a week, about 9% of their income. And then let's say that family, the parents have worked very hard, both achieved promotions, they're both working, achieving promotions, they're now at 285% of the federal poverty level. Their copay has increased to $380 a week, 25% of their gross income, which might actually be the entire cost of childcare and could be why some families are not accessing those subsidies, because financially it doesn't maybe make sense to do that. So in the proposal that you've laid out, this family would not pay more than 7% of their gross income. That would be about $100 a week, and would save that family $1,000 a month. That's like transformative policy change. So let's do that. Let's bring that here. So in addition to affordability, the biggest challenge we're hearing from providers is around staffing, both recruitment and retention. A recent survey from Starting Point estimates 2,500 vacant childcare positions in Northeast Ohio. That's about a 20% reduction in the workforce. The issue here is pay and the sector's inability to compete with places like Amazon and Target. In order to pay teachers competitive wages, they must raise tuition substantially because the subsidies are not enough to do that. In order to keep childcare affordable, though, they have to keep staff pay lower. So it is a broken system. So it's really great to hear you talk about the importance of factoring the cost of provider pay into the true cost of quality. You mentioned pay parity in your discussion of universal preschool, bringing preschool teacher pay in line with what kindergarten teachers make, because really like that distinction between teaching 4-year-olds and teaching 5-year-olds is silly, but you could extend that backwards too. 2 versus 3, 3 versus 4. So I'm going to wrap up with a question for you. Actually, I have like lots of questions that I could ask, so maybe I'll ad lib and throw a couple things out. But I would love to hear more about how pay factors in the infant toddler child care assurance. What does that look like? What would those payments to sites look like? Would that allow them to compensate infant toddler teachers as well? We know locally in Ohio that infant toddler care, it not only costs more to deliver than preschool, we know that providers, it's cost prohibitive for them to do so, so many choose to opt out of serving infants and toddlers. So what we end up seeing is low capacity for infant and toddler seats. And then I'll throw out a couple other things. As you were talking, it had me thinking about the role of business in funding all of this, right? The CHIPS Act is a requirement for manufacturers to fold childcare into what they're doing. So, like, what role is business going to play? I'm going to leave it at that question, actually. I think so. Thank you so much. And I am looking forward to hearing from Angela Newman-White, Executive Director of First Year Cleveland. Thank you.
Well, good afternoon. I want to thank Gabriella and the team for calling me at 9:20 this morning and asking me to fill in. Even though I already planned to be here because the discussion today is so important and so relevant in our communities and statewide. So First Year Cleveland is, as mentioned, a public-private partnership, and we're really hoping to work with communities, right, to identify those community-driven strategies to where not only can we invest in people and organizations on the ground to address the symptoms of that greater causal factors related to, as it relates to racism, but also be pushing policy and systems changes that can provoke and promote this long-term sustainability. I'm so excited to hear about, the investment in kind of giving families money without restriction to do what they see fit, because I find in so many instances in this work that there's so much restrictive criteria and so many assumptions about what families are going to be doing, when all you have to do is believe in folks. In this role, and what First Year Cleveland is doing is believing in communities. We believe and know that families want to thrive. Families just need sometimes a little extra support, or folks calling out the injustice that exists. One of the key priorities that we're going to be having moving forward is directly related to paid family leave. So we know that outcomes for individuals with paid leave are not only better for families, but even in the workforce, right, as it relates to staff retention, but just your ability to even care for your child. In my previous role, I was filling in for one of my team members, and I'll just never forget the day that I needed to deliver 3-pack and plays. And I had to meet a young lady down at Employment and Family Services where she had an appointment. She was pregnant with triplets. And so each child needs their own safe space. So I had 3-pack and plays for her. And she comes out and she's so exhausted. And she says to me, I'm supposed to be checking myself into the hospital today, but I can't do that because I have to go to work and I had to go to this appointment. And I'm thinking, you are risking not only your life, but the life of your children because you have to go to work. She said, I have 6 other kids at home. What am I supposed to do? And so the question here that we have to ask ourselves, what is it worth, right? Is it worth these 3 children, if this mother's livelihood, the family's livelihood, just to cover the cost, which is not that expensive, for her to stay at home when she needs to, so she can care for her children and care, for herself? Along with the paid family leave piece, of course, childcare is a huge issue. I'm so excited about the governor's budget with the investment in childcare with regards to increasing the subsidy. But I also agree that this fine line is still prohibitive for families that are making just a little bit more. So what are we doing to have kind of a mixed methods, model where we can look at, having different levels of support regardless of the amount of income that you have, because we do want to work, right? Families want to work and provide for themselves, but these type of policies can also have implications that we don't think about. It could force 2 individuals that want to get married to have to put it off for a little bit because they know that now their incomes joined on paper will remove their ability to have the subsidy. And so I always ask the question in any policy decision, who benefits and who doesn't? It's important that when we're thinking about providing support for childcare or family leave or any of these supportive policies for our youngest individuals that are eventually going to grow up and get pregnant, which is what, and have a baby, which is what our focus is, right? Helping people have healthy babies. We just have to make sure that we're focusing on the who benefits and how can we best support them. So with all that to say, because I didn't have a lot of time to have like structured remarks, I'm excited to be here. I'm excited to continue to work with partners in the community to not only realize what our full potential is as a collaborative, because we are, of course, better together. And I'm just hopeful for some extra dialogue and if I can answer any questions. So thank you.
Thank you so much. So while you all are thinking of your questions, I want to give Dr. Yoshikawa a couple minutes to respond to some of what you heard from your discussants. And then we have mics on both sides. If people want to begin lining up, that would be terrific. But let me turn it over to Dr. Yoshikawa.
Sure. Can folks hear?
Yes,
Okay.
we can hear you.
Thank you for these great comments and great ideas, and also some confirmation that these are really critical needs everywhere in the country, including here in Cleveland and Cuyahoga County. So very excited about the family child care professional development, because that is a critical understated need. It is in the book, but should have been on the slides, which is that the family child care workforce, and in fact the relative child care workforce, right? So there's a lot of care work that has to be recognized, and I think one of the things that is I liked about the Biden administration's announcement last week, but has also been part of what has been talked about, is thinking about care work as something that is reflects economic precarity. It does reflect a racialized society where the care work is borne by often communities of color, and is not compensated. And this actually goes not just for kids, but for elder care, right? So I think that's where some of those links that have been made by the Biden administration, and I wish more of it got passed, would acknowledge some of those links. But certainly family child care and supporting family care and informal care and grandparent and relative care, I think all of those are really important. I'm glad you mentioned the key principle, which is in our book and is also was built into Build Back Better, which is that childcare subsidies should not represent more than 7% of gross income, rather than routinely going up above 20%, up to, as you mentioned, for that case, close to 25% of income, which is not sustainable for anybody. And then the pay for the infant toddler workforce, I couldn't agree more. There are countries like France that really have achieved this kind of parity across the early years workforce, so that there is kind of no difference in that system. We incorporated increases in salary, but not up to the level of parity with elementary school teachers. But of course, if we were to really value early childhood and consider that the 0 to 3 years are even within the early childhood period and particularly critical period, where it requires even more skills to kind of maintain an infant toddler group or that form of care, right? And you're providing critical health, nutrition, as well as early learning support. So I do agree, and there are certainly countries that are doing that. I don't know of a state that's actually achieved that. I think we're really far from that, unfortunately. But I think it's absolutely right. And I think the point on the income ceiling for childcare is really important. But I think this principle of no more than 7% of gross income, I think, is really important. And I do hope that makes it into more and more legislation in coming years.
Great, thank you. I'll start with a question and then move over to, hopefully we've got one over here, I think. But you mentioned stress on the baby's first years research, that you didn't see necessarily some of the reduction that you may have hypothesized potentially seeing with the cash payments. And we, of course, know stress has a huge impact on prenatal health and maternal health and well-being. So, first of all, this is two-part, I guess. Is it possible that that because this was occurring, you were gathering this information during COVID, that your stress wasn't going to reduce anyway. I mean, COVID itself stressed us all out. So I'm curious, any thoughts about either stress impacts generally and COVID more broadly, the impacts of COVID on the research?
Sure. Because it was an experiment, both groups experienced COVID, right? So there was no group that didn't experience COVID. But you're right in the sense that there's additional, that kind of base increase in everyone's level of stress might have affected our results in some way. We can't tease that out, unfortunately. At the same time, both groups also did have access to, if it was inconsistent, right, 70% reported receiving stimulus payments. So there was at the same time unprecedented generosity from the federal government for some of the families. Now, I think the outreach didn't reach everybody, I think. We have to look, I'm not sure whether our immigrant families had less access or not to those, but we have to think of the COVID period as having both of those aspects to it, right? Like both kind of chronic and increased stress and childcare shutting down and all of those kinds of things. So, for example, our childcare data are very much affected, right? We can't really see our data at age 1 and at age 2 as being anything representative of what the effects on childcare might be in a non-COVID restriction context. But yeah, it's if you all have any ideas, that would be great. My sense is it just wasn't big enough in terms of an economic boost. We again designed this thinking that anything larger would be kind of like, laughed at as, not feasible in policy. Like, we had no idea that the federal government would step up with something like that. And the really important lesson of the expanded child tax credit is that the federal government can do it. It can get it out using, it can tax the IRS, but they got those checks out on a monthly basis rather than the yearly EITC. And so if you know anything about families' monthly budgeting, it's a monthly thing, right? Like it's like there's more of a month than there's more at the end of a month than your paycheck allows. So that's a routine finding in sociology of poverty and families from Kathy Eden and other sociologists. So the monthly was a hugely important thing. The fact that it was slightly larger for young kids was extraordinarily important and was part of earlier proposals that a group of us had made around how a child allowance should be structured in the U.S. And they really followed the evidence and made it larger because the costs are simply higher for young kids. And so they did that. So if it can be done once, it can be maybe done again. That's what our hope is.
Thank you. And then the other part of the stress question I want to propose to our community partners, because you also point out that there are other critical interventions or supports for parents. And do you want to speak to any of the work that's happening here locally or more that could be happening to help reduce the stress that's experienced by parents with young children?
So I'll speak to at least the supports as it relates to infant mortality reduction, of course, and parenting. So we do have some robust home visiting programs. So families that participate in home visiting have better birth outcomes and health outcomes overall. So there's so many. I mean, I'll list a couple. I'm sorry if I forget all of them, but like Moms First, Moms and Babies First, Birthing Beautiful Communities doesn't do home visiting, but they provide doula support services. There are mechanisms in the healthcare system that reduce stress, like centering pregnancy, that address the social isolation pieces. And then we also have a myriad of, so there's navigation that will connect you to any of those other social like needs that you may have. But my question as it relates to stress is, what has your tool been culturally, have you assessed for cultural differences, right? So I know my partners at Birthing Beautiful Communities had done some research in the past that they were assessing the stress level through cortisol through hair samples of Black women. And though Black women were reporting not feeling stressed, the cortisol levels actually said otherwise. And so how are we actually identifying stress, because what could be stressful to a white family may not be perceived as stressful from a Black family, but internally it is, it resonates that way.
Yeah, so we collected both. So what I reported was both self-report survey measures of stress, as well as we got hair cortisol from the mom at 12 months. We're getting it again at age 4. We found no effects on either, but we found no significant effects really zero change in the hair-based cortisol, and then these slight increases in the survey-based cortisol. But I agree, stress is something that happens both in and out of awareness. H3, we also got a measure of racial discrimination, and unfortunately we also, well, we wouldn't necessarily expect a reduction, but we did not see a reduction in racial everyday racial discrimination, a David Williams measure on that. So.
Thank you. I'm going to, Shauna, did you want to, I'm going to take this question. And please go ahead.
Hi, I'm Paul Herdig. I work for the county. Also, my practice area is economic development and workforce development. So in a lot of workforce development meetings for the past year, we've noted that we're at a moment in time when there's a labor shortage, and this may make it actually in the self-interest of employers to do some things that they ought to do anyway. And I'm wondering if we are seeing any indications of employers as a matter of hiring or retention, offering any kind of childcare benefit to their workforce.
Great question.
Yeah, I can't talk to what's been going on now, but in the past, that is certainly among the kind of corporate innovations that the business sector has done, but often large companies, and the issue is that a huge proportion of the American low-wage workforce is also in smaller businesses that often don't, well, they report that they don't have the resources to provide those kinds of childcare benefits, right? It's often the larger companies, not to discount them, because some of the very large companies also have a very large low-wage workforce. If we think of the WalMarts or some of those, and historically there have been positive examples. Like I remember being on a committee with the family policy director of Marriott, for example. But yeah, so there've been examples where corporations have stepped up, large corporations, around support of families in different ways. And you raised the issue of what businesses can do. So I think that's really important, but ultimately we have to worry about, I asked the same question, which is like, when a policy is implemented, is it really going to reduce inequality, or is it going to not change or even exacerbate inequality, right? So we have to think about anything that is out of the private sector. How do you encourage or ensure that something coming out of the private sector is not actually increasing inequality by providing more resources to families who have more opportunities, right? And that's where universal policies are really, if you look at the countries that really support early childhood in the most powerful way, they do it universally. And that are, of course, the Scandinavian countries. But there are countries, there are low and middle income countries that went to universal pre-K way earlier than we did. Ghana has had for over 15 years, a universal pre-K policy. Of course, they started implementing it about 4 or 5 years ago, but it's been on the books for 15 years. Yeah, so there are countries that are much poorer than us that have achieved things like universal pre-K, and then of course rich countries, the Scandinavian countries in particular, have a focus on universalism. I would say that getting to universalism also is often progressive in the sense that you start with the most disadvantaged families. Progressive universalism, I think it's called, is how do you get there, right? You don't get there by just opening up all the doors to everybody. You start with those who have the least access, and then you get to So I understand that UPK, if the intention is for it to get to universal, call it UPK, right? That's a reminder that every time you say that phrase, that's your aim, right? So I don't have any problems with that.
We don't have to change the name.
Thanks for that.
As long as you're growing.
Question, Paul. Do we have a question over here? Okay, great.
Hi, thanks so much. My question.
Do you mind getting a little closer to the mic? Thanks.
Good. Can you hear me? My question is around thinking about K through 12 education and racial disparities in discipline and academic outcomes. I'm wondering if you can, and that the research is pointing to bias in educators and in the school setting, wondering if you can talk about if and how that should be addressed in policy for early childhood.
Yeah, so there are some promising directions. One researcher who's done extraordinary work now into policy is Jennifer Adair at the UT Austin, who is actually an anthropologist and specializes in preschool, but has videotape based on tens of thousands of hours of videotapes showed that black and brown children have lower access to literally their freedom to determine how and with whom and with what materials they learn. Their bodies are controlled in classrooms by teachers. They are more likely to have to earn free play time, for example. And so we think about suspensions and expulsions, but we have to actually identify the critical ingredients in classrooms that are all the precursors to that, right? So I think she centers her concept of getting teachers to understand what agency means. Agency meaning the freedom and autonomy to have some, like, can you walk over to a peer in another group and show them what you just learned, right? Can you demonstrate what you're learning to peers, to the teacher, and have a response? And so she has shown, and then turned these videotapes and what her research has shown into rubrics that then have transformed the San Antonio UPK system to completely adjust how they think about quality, to think about opportunities for agency. And on that scale that they've developed, the entire UPK system there has improved in terms of that kind of equity that she ties directly to racism as it shows in preschool classrooms. Then there's a professor, Vanessa Rodriguez at NYU Langone, who is doing extraordinary work on considering black and brown preschool teachers' experiences and how they experience schools and have emerged from, kind of racialized school systems and how they can be supported to be able to provide support and think about their well-being first and foremost. So I think an emphasis on well-being, on culturally responsive pedagogy, on agency, and thinking about the workforce, not just the kids, is really important.
Shauna, did you want to add to that before we could?
You have to hold it really close. Eat the microphone. I just want to thank Amy for that question, because locally we just finished a sort of like pre-pilot phase of a project we're calling EPIC, Equity for Education in Preschool Classrooms. And so this is using work and partnering with a woman named Maureen Joseph out of, I think she's at Tulane. And she has what she calls racial identity processing groups that they're using in a counseling program. And she gave a talk here a couple years ago. And so we are partnering with her and her team to test that model with our preschool teachers. So we just finished the pre-pilot phase. I see people in the room who were part of that work. It was 10 weeks of essentially group counseling around racial identity processing with different affinity groups by race. And then lots of focus group discussions after that to think about sort of what did we get out of that experience and how can we modify that to tailor it to early childhood educators, all in an effort to recognize and reduce bias in the classroom. So really being aware, for example, of how are we restricting the movement of certain children and not others? What are the ways that, like, really sort of being able to pull that work into those racial identity processing groups and thinking about how your own racial experience is playing out in your role as a teacher, as an administrator. So lots of research that we need to read to sort of inform that work, but I think it's a good question, Amy.
Thank you. I think we have time for one more question. Joy.
Hi, so I'm Joy Welch-Bay. I am the UPK program manager. I'm also with Cuyahoga County Invest in Children. I know, Shauna. I just had a quick question because as I was, reading through everything in the proposal and the program, I saw pre-K, or the idea for universal pre-K, being aligned with K through 3. And we're finding, because we do have that cross modality with UPK in Cuyahoga County, and we have it in you have it in school districts, we have it in family child care, we have it in centers, that we're seeing a lot of times our school districts, one in particular that we recently met with, are saying that School districts a lot of times aren't looking at preschool with the value that we hold it with, right? They're worried about the bottom line of their K through 12 program. The preschools that are there, their UPK classrooms that are there are more so just fillers. And so even though as UPK, we're giving quality dollars, they're getting dollars for running these programs, it's still not looked at with the value of their K through 12 and more so kind of looked at as a babysitting component to their K through 12 program. So how do you create that alignment and how do you create that value for preschool when you have school districts that are so already ingrained with the idea that the lower value is found in pre-K programs and early learning programs?
Thanks. You know, I'm just going to say we have about a minute, and if we could then, if you might each have a final thought, but we'll start with Dr. Yoshikawa.
That's a great question because I think it is far too common that we see that a principal, for example, or district leadership view pre-K as being something, yeah, they do their own thing and they're fine, we don't have to worry about them, is kind of usually the kind of response that we get. And we think the reframing of the first years, the first several years of schooling as a pre-K to third grade was a very important movement that continues to this day, but we still have few models for it. The Boston pre-K system that I worked with and continues to innovate on this front has had a pre-K to third movement where they redesigned their kindergarten curriculum first based on the pre-K success, then the first grade based on kindergarten, and then they moved up rather than going down, right? Doing downward kind of curricular reform. So their curricular reform was based on pre-K and moved up to now third grade. And now there's studies looking at the long-term effects of that exposure to what is, so I think one way to do it is to think of that as a single period, and that's as long as high school. It's actually longer, right? 3, 4, 5, 6, 7, right? Like, so this is like 5 years of schooling. You cannot ignore 5 years of schooling and then just, so I think that's really the long-term solution, and that occurs through things like alignment of curricula, making sure curricula build on each other, and that, like, kids in kindergarten are not just learning the same thing they learned in a high-quality pre-K, or that the kindergarten teachers are not just working with the 2 kids who weren't in pre-K or something like that and focusing on their level of skill. So those are common things we see. We see a lack of sequenced curricula in math, in language, in science, and I think we have to build in environmental science much earlier. I think then thinking about sustained parental engagement strategies so that we take all that great Head Start activism of the parents and really sustain it, right? So that they're not just like dropping off into a cliff of like, oh, it just becomes, twice a year parent-teacher meeting, whatever the thing is. So I think those are some of the, and joint professional development so that the professional development occurs across grades. Those are some of the strategies that we've heard about.
Thank you. And thank you all for coming. This was a wonderful discussion. Dr. Yoshikawa, Dr. Rohrman, Angela White, to all of our guests, we thank you very, very much. Especially want to thank our community partners and the Gunn Foundation for supporting us with this wonderful lunch that we were able to share today. Please help yourself to any lunch that you'd like to take with you on the way out, and enjoy the rest of your day.